Hello, and thank you for joining this live digital conversation from wherever you are. Technology has proven to be more than a good friend, actually very dependable in these COVID-19 times. For you, my friends and followers on social media, I'm happy to continue to avail myself and interact with you. At the end of this evening session, I'll take a few questions, as I usually do, on the issues that I'll be raising. Just prefix your question with the hashtag #JohnMahamaLive. Thank you. My brothers and sisters, one of our best and most enduring qualities as Ghanaians is that, notwithstanding the nature or extent of adversity we encounter, we as a people have always been positive in our philosophical outlook. It is this strength of character that in many ways have determined our approach to life. And this is why I do not have any doubt that with the Almighty God on our side, with the specialist knowledge and professionalism of our medical practitioners and experts, with the ever-present creativity and industry of our people, and with every single one of our people united towards a common purpose of conquering the coronavirus pandemic, we shall overcome this current existential threat we face. I pray for God's overwhelming healing power for those who are sick, including even those who are asymptomatic. I console bereaved families and commend our gallant health workers and our men and women in uniform, service personnel, for their sacrifices towards our common quest to heal our land of this pandemic. When we close the chapter on the year 2019 and we welcome 2020 with the usual fanfare and jubilation, we could not have predicted that so early into the year, almost every aspect of our life will be so profoundly affected by a global pandemic that has brought countries on every continent to their knees. But the signs were on the wall. Our schools are closed, our churches and mosques are shut down, some of our markets are closed or heavily regulated, our movements have been curtailed, and anxiety has become a palpable reality of our daily lives. Guided by our very recent experience in our sub-region, the effect of this virus in many ways is like the Ebola virus that ravaged our West African neighbors, Liberia, Sierra Leone, and Guinea, a few years ago. I recall at the time there was a clear thought in mind when I stood before the United Nations and also Westminster to galvanize support for our neighbors who were suffering. I stated that Ebola was a virus that compromised our impulse of touch and closeness to comfort our loved ones who were infected. I mentioned that Ebola was a disease of isolation, and worse, it left many survivors ostracized and stigmatized. Care and affection are basic human traits, and when a virulent disease such as Ebola makes it impossible to show care and affection to our relatives, to our friends and loved ones, not even to get close or hug them, it is a most strange and difficult proposition. Sadly, these unfortunate developments are playing out before our very eyes with the current coronavirus disease. This is exactly when our brothers in Nigeria in February became the first in our sub-region to report a case of the coronavirus, I immediately called for an aggressive preventive measure to be put in place so that the disease does not spread into Ghana. We all hoped and prayed that this will not happen, but it was not to be. But now that it's here, we owe it to the people of Ghana to ensure that every attention, every decision, every human and material resource should be aimed solely at stopping the spread of the virus. We must manage cases to ensure speedy recovery and continue to have and build a secure and united country at the end of it all. In all these, my thoughts have also been on the state of our country after the pandemic. How different will our world and our country, Ghana, look from the world that we have known before? No country, nobody will go back to business as usual. In the coming days, I look forward to hosting further digital conversations on how we can rebuild our country, Ghana, and prepare it for the changes that are to come. I'll work with you all to prepare our country, Ghana, for the new world which will emerge after this pandemic. For now, however, my brothers and sisters, I trust that you're doing well and that you're staying safe and that you're taking the necessary steps to prevent yourselves and your families from getting infected with this deadly virus that we have to battle with. Staying safe no matter what is what we must all strive to do. Because as you may have also heard, in the model government is working with, the projection is that up to 3 million Ghanaians may be infected by the virus. And a significant number will require hospitalization or may even die from the virus. In his last address to the country, the President, Nana Akufo-Addo, lifted the partial lockdown imposed on Greater Accra, Greater Kumasi, and their environs, and Kaswa. At the time the country was recording increasingly higher infections, it was therefore not surprising that many Ghanaians, including public health experts, were puzzled about the considerations underlying the President's decision. The number of infections are not only rising steeply, but there's also clearly a horizontal community spread of the virus. The majority of the regions in our country have reported cases, and the bulk of the positive cases we are seeing are of people who have no history of foreign travel. One wonders whether, in his decision, consideration was given to the huge backlog of tests that have not yet been cleared, and the many possible cases roaming in our communities that have not yet been tested due to a lack of mass testing. Using the examples of countries that are seeing a decline in their case numbers, the science shows that public awareness on prevention protocols, accurate data, widespread testing, effective contact tracing, isolation, treatment, and care are the critical factors for success in overcoming COVID-19. Transparent and accurate data is critical if we are to achieve a better and deeper appreciation of the trajectory of this contagious disease in Ghana. Unfortunately, many health professionals have begun to question the credibility of the data and models being used by our national COVID-19 team. While it is the prerogative of the President to take the decisions that ensure our safety and protection, it is my hope that his decisions are guided by a genuine concern for the health and safety of the people of Ghana, and are also guided by science, not any political or parochial considerations. It is unfortunate that a high-ranking member of the President's party has suggested in recent days that the Electoral Commission should and will go ahead with the compilation of a new voters register as soon as next month, no matter how many Ghanaians die. At a time when doubts remain about the scale of the COVID-19 threat, and when social distancing has become our main defense, this suggestion is deeply irresponsible. Outbursts like this create doubt in the minds of the public if there are no political underpinnings to the president's decision. At this stage, we can only hope that consideration was given to the fact that the effects of the initiatives such as the local manufacture of personal protective equipment, PPEs, are yet to be felt in our health system. I must say, I'm deeply concerned about the health and safety of our health workers, considering that there are still loud complaints from many health facilities about the lack of basic protective gear. We need to protect our hard-working health workers. Not a day passes without emails, phone calls, Facebook, Twitter, Instagram, and WhatsApp messages from nurses and other medical staff from facilities across the country reaching out to my office and pleading for protective gear, PPEs. Right from the start of this pandemic, public education and awareness has been poor. Messages must be crafted in all the local languages and aired extensively on all our media of mass communication. The current scenes in our markets and public places suggest that the President's exhortation for self-discipline has largely not been heeded. Now that the lockdown has been lifted and the virus is mobile again, we must heed to the call to always wear face masks or face coverings in all public places. Government should speed up the initiative of manufacturing locally made masks, which can be washed and pressed or ironed and reused again. These should be handed out free of charge to the public. Strong public education on the safe use of masks must accompany this initiative. One gets the sense that perhaps because of the current low mortality in the cases we have confirmed so far, the President might be seeking to rely on what is called herd immunity as a strategy to fight COVID-19. But I dare say this is dangerous. We must remember that there are reports of reinfection occurring in some cases elsewhere, and also prolonged immunity to the virus has not yet been proven at this stage. The example of the UK at the initial stages of the pandemic, relying on possible herd immunity, is a stark reminder of the dangers of such a strategy. Eventually, Prime Minister Boris Johnson nearly became a casualty of the virus. While it is true that the rate of hospitalization among those testing positive in Ghana is lower than in the UK, it is also true that we have a weaker and less efficient health system than the UK. The burden of the coronavirus disease could potentially be very heavy. COVID-19 has overwhelmed the health systems of most advanced countries and can do the same in Ghana. The toll on our healthcare workers could be devastating. You can buy ventilators and other medical items on the market, but you cannot go to the market and buy skilled doctors and nurses and other medical staff. As it is, we are currently relying on hope. Hope is good, but science helps you to hope better. It is important to note that government's humanitarian intervention to alleviate the unintended but predictable consequences of the lockdown have been an abysmal failure. The distribution of food was chaotic and disorderly, and in some cases partisan. It flouted all protocols of social distancing and prevention of the spread of the virus. Definitely no careful planning went into the implementation of this initiative, as is characteristic of this current administration. My suggestion to involve assembly members and traditional rulers, religious leaders, and civil society organizations were ignored. As the president clearly admitted, this was one of the reasons for the lifting of the lockdown. Many Ghanaians were faced with two choices: either to stay at home and die of hunger, or come out and take their chance against the deadly virus. Faced with these two choices, most Ghanaians opted for the latter. I therefore can understand and I empathize with the sports of jubilation that greeted the announcement of the president of the lifting of the partial lockdown. With a budget in excess of 1.2 billion cedis from the Stabilization Fund, I believe we could have handled this mitigation effort much better than we did. Examples from some of our fellow African countries, including Togo, our neighbor, Cote d'Ivoire, our neighbor, and Rwanda, demonstrate how an extended period of lockdown can be supported by a well-coordinated, enhanced, and effective social mitigation program. My office has been flooded with correspondence from many working-class people, especially in the private sector, who have not received their February and March salaries and are having a difficult time feeding and taking care of their families. The lockdown may have been lifted, but many businesses are still down and suffering. Employees are suffering too, just as the many players in the informal sector are also suffering. It makes me wonder why our Social Security and National Insurance Trust has not been responsive in this time of need of many of its contributors. Social Security contributions are essentially an insurance scheme made not just for pensions in old age before we die. They are also meant to help contributors in times of adversity such as this. Remember that not all will come out and queue for food. Not all will come out of their homes to receive the food boxes that we go around and hand over. But as has been done in other countries like St. Lucia, I think a token payment of all contributors of a certain token sum over 3 months would have afforded many the assurance of feeding their families during these abnormal times. While we wait for a clearing understanding of the factors underpinning the decision of the president to relax efforts to manage the spread of the virus, I urge all Ghanaians to continue to be responsible and not to assume that the country is out of the woods yet because of the removal of the lockdown. I want to strongly encourage all my fellow citizens, particularly the aged and those with underlying medical conditions, to continue to remain at home. The young are also advised to exercise precaution because in the reality of the COVID-19 Russian roulette, and for those who don't know Russian roulette, Google it, nobody knows who will live and who will die. If you please have nothing essential or urgent to do outside, please continue to stay at home. Avoid shaking hands or joining large gatherings. Let us regularly wash our hands with soap and under running water, or resort to the use of alcohol-based hand sanitizers where possible. Continue practicing social distancing or stay at least 1 meter away from anybody you are with or talking to when you step out of your house. And please wear a mask to protect yourself and others from infection. On this note, I commend and congratulate all who are working and producing masks locally, including the Medical Women Association of Ghana, Dr. Jifaku Wonu and her colleagues, who are also producing masks to support the fight against COVID-19, and the many others who are doing so. I still urge those who can afford to show compassion and share whatever you have with the less fortunate, especially the vulnerable, including people with disability, to continue to do so. Let us all join hands in demanding accountability and transparency from the government in the management of the COVID-19 funds. After all, these are public funds contributed by taxpayers. And I'm passionately appealing to government to ensure a timely release of these funds to the institutions, health and non-health, so that they can discharge their duties appropriately and according to plan. I wish to also repeat my call for government to ensure a reduction in the cost of internet, because students and pupils need internet to study from home. They've been home for over a month, and some students are really struggling to cope with the cost implications of the online lectures they are taking. In similar vein, let me also encourage the need to allow for flexibility at workplaces in order that people can continue to work from home where and when necessary. Issues have been raised about the discrepancies in data on COVID-19 put out by the government. Some of these discussions have been led by the renowned Ghanaian pathologist and former director of the Ghana Health Services, Professor Ajiman Bedu Akosa. I urge government to adopt the attitude of assurance and reassurance while explaining the sources and nature of the data discrepancies in the data, because we need to build trust, transparency, and confidence in the process and the fight against the virus. It does not help our collective fight against COVID-19 when some overzealous appointees resort to insulting persons who question the information being put out by government. While thinking and working locally, we must also keep an eye on treatments and/or vaccine development. This will ensure affordability and availability of drugs and vaccines when they become available. I called a few weeks ago for a virtual ECOWAS summit in order that our leaders can coordinate the response to the pandemic in respect of border restrictions and sub-region-wide COVID-19 response measures. I'm happy and heartened to hear that such a meeting has taken place or is planned in order to better coordinate our fight against the virus. This is necessary in order to avoid unilateralism in what is a collective struggle. We did this during the Ebola outbreak, and it served the sub-region well. For instance, it is reported that Ghana's unilateral decision to lift the lockdown has put extreme pressure on our neighbors to do likewise, even though we are all not sure whether Ghana's decision is the best course of action to take at this time. We're dealing with a new disease and are not yet sure how it will behave going forward. Meanwhile, let me once again underscore the need for testing of Ghanaians for COVID-19. Now that we have lifted the lockdown, government must truly expand our testing capacity by fast-tracking regional testing centers to remove the long delays before results reach hospitals and patients. Such delays do not only cause anxiety among the patients and health workers, but also lead to inadvertent spread of the infection. In conclusion, I would like to reiterate that as a nation, for us to succeed, we need to see from the government that leads us a demonstration of trust and respect for all, no matter which people are involved or where they're coming from. We must be open to constructive criticism and be receptive to the pragmatic suggestions from experts, because these are critical ingredients that will engender trust and a collective will to support the battle we're engaged in with this pandemic. It is not too late for us to unite, truly unite, and to be transparent and accountable to the people. My fellow citizens, countrymen and women, we're not in normal times. We must all put our shoulders to the wheel with patriotic zeal, devoid of partisanship and parochial interest, and help with all our hearts and might to fight COVID-19 aggressively and decisively. And I believe together we will win. Thank you. And I'll now proceed to read out some questions that you've posted to my Facebook, YouTube, and Twitter handles. I thank you for your attention.